Now to this. January marks Cervical Cancer Awareness Month, a time to highlight the risks of cervical cancer, which sexually active women can be susceptible to through the transmission of the Human Papillomavirus, or HPV. Women between the ages of 21 and 65 are at risk of developing the disease. According to gynaecologists and obstetricians Dr. Shauntelle Winchester and Dr. Victor Wheeler, one of the most effective ways to prevent cervical cancer is through regular pap smear. Reporter Joeshel Dann once again with the details.
According to Dr. Shauntelle Winchester, a gynecologist and obstetrician, the disease is caused by the human papillomavirus, which is transmitted through sexual intercourse. While cervical cancer develops slowly, it can be detected in women between the ages of 21 and 65.
Cervical cancer is cancer of the cervix. The cervix is the part of the woman's reproductive system that connects the uterus or the womb to the vagina. So we refer to it as the neck of the womb. This is when abnormal cells are developed at the neck of the womb, and then it can invade the rest of the body.
Dr. Winchester explained the procedure, reassuring women about what to expect.
This is a speculum. This is the instrument that is used to place into the vagina. So we insert it into the vagina, and in order to visualize the cervix, and the spatula or the brush, these are the instruments we would use to obtain the cells and put it on the slide and then send it to the lab.
And if no abnormalities are found during that time, screening can be stopped. Dr. Victor Wheeler, a gynecologist and obstetrician, noted a decrease in cervical cancer diagnosis on the island. He explained that the disease takes 10 to 13 years to develop and is most common in women over 50, which is why pap smears are not recommended for women under 20 due to their undeveloped cervix.
And we also don't do any pap smears before 21, because under the age of 21, the neck of the womb is still going through the maturation process. So there may be some abnormal cells that may be picked up on the pap smear that are not going to develop into cancer.
He explained that pap smears detect cervical cell abnormalities, which can be tested for cancer. If cancer is found, the patient will be referred to a specialist for treatment.
If you can identify these abnormal cells, then you would be sent to do what is called a colposcopy, which is a special procedure where you use a microscope to magnify the neck of the womb, and you can put certain stains on it. And if you see an abnormal or suspicious area, you can remove just that small part of the cervix and send it to be tested.
Joeshel Dann, Tobago Updates, Television News.